Right, so today I'm going to talk a little bit about my recovery and the surgery I had for ACDF, anterior cervical discectomy and fusion. I am 6 days out from the surgery. About 6 months ago, I started having pain in my left hand, numbness, these three fingers. Couldn't move my head in a certain direction without triggering it, couldn't sleep at night. Took some medication, had some shots, eventually got an MRI to show that I had the discs between C5, 6, and 7 were bulging and pushing back on my spinal column, resulting in the surgery. I'm 6 days out from the surgery. So I had the surgery 6 days ago. As you can see, I'm still in the collar. I'm still in a loose-fitting t-shirt, which I'll get into a little bit, but I wanted to kind of talk to anyone who's had this surgery on what the recovery process is like. First off, instant gratification from the symptoms. The pain in my left arm, the numbness was gone the next morning. So right away I knew that the surgery had worked. I can sleep, I can move my head, I can sleep on my belly, I can tilt my head back. No numbness in my fingers or hands whatsoever. So the surgery worked. The process itself was easy. It was inpatient. I did stay overnight because I had some complications with my heart rate and some oxygen levels. My surgery was done at about 4 o'clock in the afternoon, so they kept me overnight. It was an uncomfortable night in the hospital, being hooked up to the IV and the everything hooked up to you, the neurological stuff. But they let me go the next morning. The day after surgery, I was good. Still kind of flying high from the pain medication. No site pain, no neck pain. I felt great. I've got pictures of me smiling and being home with the family. Day 2 was rough. Day 2 after the surgery was where the pain meds kind of wore off from the IV and I was on the oral medication. That was rough. The site started to, you started to feel the pain where the surgery is, and if you look at what the surgery actually entails, you can see it's quite an invasive major surgery. They spread the neck wound open and get in there and dig around with a Dremel tool and get that disc out of there, and then bear down with some screws to get that plate in. So I've got a 2-level plate. So day 2 was rough. So far, the biggest thing about the recovery has been this damn thing, the collar. As you can tell, I've got very little mobilization. The idea is it's keeping your neck straight to allow the cages with the bones in there to fuse correctly. The plate itself is doing its job. The cages have replaced the cartilage between the discs, so that's all good. This is more to keep my neck from moving so I don't fuse. And what you don't realize is how often you look down. The big thing the doctor told us was no looking down at stuff, no tucking your throat, tucking your chin down. And you start to realize how often you actually do that once you've got this collar on. Second thing they told us is wear loose-fitting clothing, hence the wife beater. I don't usually wear one of these, but they said put on shirts that don't tug on your head when you take them off or when you pull them down. So invest in some of these. You'll be wearing these for a few days. The other thing I invest in, if you've had dental surgery recently or a family member that's had dental surgery, get one of these things that they wrap around their head for surgery. This can be frozen or wrapped around your neck to keep the site from swelling, because it does swell and bruise quite a bit. Also, straws. Get lots of bendy straws, because you are going to want to keep your fluids in, and you are going to have a hard time tilting your head back to drink from a soda can or cup. So lots of straws to sip from stuff. The collar itself is definitely doing the job. I don't sleep with it. They told me I'll do whatever I want when I sleep, but I'm supposed to keep this on until my consulting appointment, which is approximately 2 weeks after the surgery, again, to keep the neck straight and allow those bones that they inserted to fuse. The wound itself is pretty good. As you can see there, it's got some bruising, no stitches other than 2 at each end. They use super glue in between. The only major issue I've really had, I can move my neck pretty good. Obviously, I don't want to tilt forward. I've got a decent range of motion. Nothing really hurts here other than a little bit of swelling. As I've had issues in my throat with either a loose flap of skin or inflammation from the tube in my trachea that kind of gets caught up. You can hear it flapping around in there. I don't know if everyone gets that. I know you do get a sore throat. A couple of days afterwards I did have that, so I have lots of ice water and lozenges, throat lozenges in place. But I did have some issues with what feels like something stuck in my throat. The first few nights when I'd sleep, I'd wake myself up kind of as I could feel something blocking my trachea, and I don't know if that's a result of the surgery and the invasive process or a skin flap loose in the throat. And you can tell my voice is a little bit weird because it feels like it's right around my vocal cords. But that's the only major issue I've had. Get up in the morning, I put the ice pack on for about 20 minutes, drink a cup of coffee, just kind of be careful about not looking down. I do some stretches to keep my neck mobile because the collar is going to keep you very mobile. And I use the breathing tool because you want to be able to keep your rib cage and your spinal column expanded from the lack of movement in your neck and your upper body. Nothing really hurt around here. I had a little bit of soreness inside from where the tube went in, but that's about it really. What you realize with the collar is how often you actually look down. You look down when you're going down steps, you look down when you're brushing your teeth, so you've got to be very strict about either keeping the collar on or keeping bending like this to keep your neck. Sleeping is fine. Like I said, I can sleep fine. The numbness I had when I was sleeping is gone. The doctor said you can do anything in your sleep with your collar off, so I sleep on my belly with my head up, which I haven't been able to do for about 6 months because of the symptoms. Try and get some exercise. I've been walking just to keep the body going rather than sitting in a bed or a chair. Obviously I can't lift. I've got a weight restriction, can't lift anything over, they say a jug of milk, so anywhere 5 to 10 pounds. Again, you don't realize how often you pick something up like that. You're reaching for stuff like, no, I can't grab that. But otherwise I've been very happy with the surgery. Other than this cool scar, I still feel like I've had surgery 6 days later. This is my voice going again. But I'm so happy with the results of this being done. I'm very happy with it, and this will go away. So I'm looking forward to being more active, not wearing a wife beater every day. I'm being able to almost look down, being able to shave my head and my beard. So if you're beard guys, this collar is going to be a real pain. They trimmed my beard a little bit to do the surgery, but I was able to keep the beard. But this collar is going to get itchy if you have a beard, and you can't really shower for about 3 days or immerse the wound. And there's the collar back on. So yeah, it's been a great surgery. The recovery has been fine. Been very happy with the results. This is kind of a pain. The ability to not exercise or do anything or grab things. I love milk, so I can't grab a jug of milk and take a pull from a jug of milk or a pull of orange juice. Able to eat okay. The first few days I didn't really have any food restrictions. Had pizza last night. First day it was a little bit iffy. I had soft foods just because of the throat soreness, but otherwise day 3 I was ready to go. So day 6, here's where we're at. I've got my appointment in a week to see if I can take the collar off or what I need to do. And again, no real issues other than some kind of throat soreness and some redness, swelling around the wound, which you keep under control with the ice. But yeah, if you have any questions or comments, do the whole, this is my first video, do the whole post and I'll respond if you have any questions about the surgery, the pain levels, that kind of thing. And be happy to respond to anyone that's getting ready to have this surgery. I was very nervous about it. This is my first kind of major surgery, other than some old football injuries. Also having a spouse helpful to do things, change these ice packs, keep these swapped out so you've got two cold ones to alternate, to help you reach and grab things. The first couple of days, wife was very helpful about getting me down the steps, because you can't look down. You forget how often you look down with the steps, just because of this damn thing. Having a significant other or friend, wife, spouse to help you with those things is very helpful the first few days. Probably another week or so, I'll post another video to see where we're at 2 weeks out. And again, if you have any questions or comments, post them below, and I'll be happy to answer them for you. Thanks.